Good afternoon, Dr. Elizabeth. I'm Brian Sam. How are you doing today?
I'm doing well, Brian. How you doing?
I'm great as well. I really appreciate you honoring my invite. I don't mean to take up much of your time, but I'm working on a project trying to identify the current challenges faced by healthcare providers and the requirements for improving mental health service delivery in the city of Hamilton. So I have a few questions for you, and I would like to get your feedback on these questions if you don't mind.
I'll be glad to help.
Okay. So my first question is, what are the primary challenges you face when providing mental health services currently in the city of Hamilton?
Well, currently the challenges we have is usually the long wait times for patients and the fact that they have limited access to professionals to diagnose them of their issues.
Okay, okay. So what improvements would you suggest to make the mental health service work efficiently?
Well, with the challenges that we have currently, right? Oh, I mentioned the long wait times.
Mm,
I believe we need to improve on that aspect, to get more patients in the system instead of making them wait for long appointments. And I also believe that like we need more healthcare providers because they are so little right now and they are not able to handle the crowd of patients that they have currently. So I yeah, I believe we need more healthcare providers too.
okay, okay. So, what roles do you think technology can play in these improvements to mental health services?
I believe, with the high rise of technology right now with AI and machine learning, I believe an application can be created that helps patients access medical care faster and they don't really have to wait for that appointment to come to fruition. They can as well just work their thing on the app.
Mm.
They get their diagnosis, they get their medication, they get everything they need from the app, which makes it very easy for everybody.
Okay, okay, okay. So, are there certain procedures you think should be updated or changed while working with mental health patients, and why do you think so?
Well, I think the procedures can be worked on. That would be then again, long wait times.
Mm,
We can create these applications that help the patients get faster access to um, the professionals. And also, we can create a volunteer system for the healthcare providers. So junior healthcare medical personnel are able to help with the staffing issue.
okay, okay. So, how can we ensure that the new system meets the demands of healthcare providers, patients, and administrative personnel effectively?
Hmm. Okay. So I would say we can maybe conduct surveys quarterly in a year, and that way we're able to get the feedback from them so we know what areas to improve on and what areas are good currently that we can just keep working on.
Okay,
I don't know.
okay. So what can we use to measure success in this new system that we are about to put in place now?
Yeah, as mentioned, we'll be conducting surveys
Mm,
with residents, with the administration personnel, and also the healthcare providers, especially the patients. So we know what they want and how they want it, so we're able to implement these changes.
okay, okay. So in this new system now, how are we going to make sure that these challenges, like challenges that come up in the future, how are we going to make sure they are handled on time before they become like a real problem?
Hmm. So yeah, it's obviously I believe a team will be created specifically for that. So there'll be a team to handle the backlogs, the feedbacks, and also any issue within the system. So that way they are handled pretty fast, which makes every the job we're doing very efficient. So everybody gets the good part of the system, basically, including the patients and the healthcare providers.
Okay, okay. Well, thank you very much, Dr. Richardson. I really appreciate you honoring my invite once more, but that's all the time we have today. So I'm going to get back to you with the feedback after I have made my findings. So thank you
Okay.
once again, and I hope you have a lovely day.
You too. Thank you so much.
Thank you.